Questions?
Governor, what do you make of this idea that herd immunity is not possible across the country? Obviously, Massachusetts, there's tremendous vaccine uptake here, but we are part of the country. So with herd immunity not necessarily possible, I mean, should people really feel terribly comfortable heading toward June in that 4.1 million number?
I think the way that we're thinking about this question about herd immunity is the more people you get vaccinated, the safer everybody will be as individuals and as a community. But in addition to that, the take-up rates, as Dr. Bittinger spoke to, and I may have him answer this question as well, the take-up rates among the populations that are most vulnerable across the U.S. are very high. Now, they're higher here in Massachusetts, but they're very high everywhere. I mean, my recollection here is we're somewhere in the high 80s in terms of the over 75 population and the mid 80s among the over 65 population. And nationally, I think we're pretty close to 80% on both of those populations as well. High 70s, low 80s. So the community that we all worried about the most at the very start of all this, and continues to be the community that's most at risk across the country, has been pretty successfully vaccinated so far. That has huge consequences for both the hospitalization issues and the issues associated with mortality that Dr. Bittinger spoke to. And I think our goal is going to be to just make this possible for everybody who wants to get a shot, and to do all we can as we work through that 30% that hasn't been dosed at least once yet in Massachusetts, to try to create more accessible and easier and sort of closer to home sites to get it done, for whatever reason that they might not have been vaccinated.
Can you tell us who this 30% is? Are these people who just don't want the vaccine at all? Are these people who just don't have time to sign up? Who exactly are you targeting?
Well, the data on the survey work that we've seen and that we've done basically says that the vast majority of the 30% that haven't been vaccinated yet aren't people who never want to be vaccinated. They just didn't want to go first. Still operates under an EUA. There's tremendous amount of real world experience at this point that they are safe, vaccines are safe, and they are effective. But in some cases, it's literally just us getting to them and making it easier for them to get vaccinated. That's why the mobile sites are going to be a bigger part of what we do going forward. It's why we're going to continue to invest in partnerships between hospitals and community health centers and local organizations to bring vaccines more closely to people who may not have access to transportation or some other mechanism to get vaccinated. And I think for us, the great news here is that given options and opportunities, a huge portion of the adult population in Massachusetts has already chosen to get vaccinated. And the goal for us now is to try to do some things to try to create a more local and regional opportunity. The percentage of the population that was just no in Massachusetts, remember, was way under 10%. So we still have a bunch of people we think we can reach. Do you want to take a run at this question about herd immunity? Yeah.
So often when we use the term herd immunity, it's about eradicating a disease in the community, like measles. When we talk about herd immunity, it's that there's not circulating measles. And I think there is an evolving thought about whether we can eradicate COVID in the community, the coronavirus, and probably not. But it's about managing the consequences so that even if there are low levels of COVID, all of those who are vulnerable, and most of us in general, are protected and not sharing the virus. And so as a consequence, people are very, very unlikely to need hospitalization, even less likely to die of the illness. And so, there are other coronaviruses that cause basically common cold. The hope is to minimize those consequences, get this COVID, get this coronavirus down to be as close to an ordinary infection as opposed to the extraordinary one that we've gone through.
Doctor, is there any kind of a public health danger of closing down some of these mass vaccination sites that we've relied on so heavily, or are you totally on board?
So I think the public health danger obviously has been so effectively addressed with COVID, and our job, or with, excuse me, the vaccines against COVID, and our whole job is to continue vaccination. And so I think the best thing to do is to just maximize how we're reaching those who are yet unvaccinated with targeted efforts.
Do you feel comfortable saying the worst of this is behind us here in Massachusetts?
I would love to be able to say that. I think we've seen incredible progress. The numbers have come down, overall case rates, positivity rates, numbers in the hospital, numbers in the ICU. So everything's pointed in the right direction. So we're really, really making great progress. I think the most important thing, again, to suppress variants, to make sure we stay healthy, is to finish the work that we've been doing so far.
Doctor, do folks who, for one reason or another, don't get vaccinated, do they put others who have been vaccinated at any sort of risk?
So we obviously want to have as few people who've been unvaccinated as possible in the community, because they can transmit disease, and there are those for whom a vaccination may be less effective, such as the significantly immunocompromised. So we just want to vaccinate everyone we possibly can. We still, of course, have many of our distancing measures in place, indoor masks now, et cetera, and we'll continue to follow the science about what we know about how the disease is transmitted once we get even higher and higher levels of immunization.
Governor, could you ask me about the second dose? You talked a little bit about I don't know if you're facetious, but 99% of people come and get a second dose. What is the percentage? Anecdotally, it seems like years people are not going to get their second dose. What's sort of happening, and what are you doing to make sure that they do go and get it?
So the real world experience in Massachusetts anyway is literally basically almost everybody who gets a first dose gets a second dose. I mean, we've had very little drop off from first dose to second dose here in the Commonwealth. Much higher percent of our population has showed up for a second dose than we've seen in the national data. I think there's a couple of reasons for that. One is almost all the operations, the hospital operations, the regional collaboratives, the mass vac sites, community health centers, almost all of the organizations that have been part of our world on this have operated under a model where we want them to schedule people's second doses before they leave when they get their first dose. And I think most people who've been vaccinated would tell you that during that 15-minute waiting period, there's someone hovering around you, or you're getting a text message on your phone or an email that says it's time for you to schedule your second dose. And we've had very little no-show on the second doses here in the Commonwealth. And I think we would expect that would continue to be the case. People seem to get the idea that for both Pfizer and Moderna, you really need to get both to be sort of fully vaxxed.
Why do you think this part of the country, New England, has about 5 states that are at the top? I mean, why do you think it is that people in this part of the country seem to think that the vaccination is important to get done?
I think, first of all, this part of the country took it pretty hard to begin with, and I think that left a lasting impression on a lot of folks. The second thing I would say, and this is, this is me tooting Massachusetts' horn a little bit. We are by far the biggest state in New England, and we're the only state in New England that's part of the top 25 states that have at least 5 million people. Smaller states, generally speaking, in terms of population, have generally had more success than some of the larger states in getting to a bigger proportion of their population faster. But I think the region overall has been pretty focused on beating this virus back, and I think people buy into the idea that the best way to beat the virus back is to get vaccinated.
Governor, can you run down again which mass vaccination sites are closing, and was this a decision that these venues needed their space back, or was it, how did you make the decision which ones?
Well, first of all, remember, this is the end of June, right? During my remarks, I talked about the fact that these folks are still going to deliver a heck of a lot of vaccine over the course of the next 30 to 60 days. I mean, I'd look it up, but I'd probably get it wrong. I think it's somewhere in the vicinity of about 430,000 shots. First and second doses are still assumed are going to occur at the mass vaccination sites over the course of the next 30 to 60 days. The 3 sites that are scheduled, and that doesn't include some of the stuff they'll do with groups and on walk-ins in some cases going forward, but the 3 that are going to close are going to be the Hines site, which, remember, is tied to a temporary relationship that we developed with FEMA. It was always assumed that at some point FEMA, what was it, was it 6, 8 weeks? It was 8 weeks to begin with? Do I need any more detail than that? Okay. And Gillette and Natick are the three. And Danvers, sorry, and Danvers.
How did you make that decision? Which one?
I think it was basically driven by, A, the availability of alternatives, which makes a big difference in this regard, and B, the relative level of participation that we projected out as we went forward.
Governor, has the J&J vaccine been less of a game changer than you had hoped?
Yes, for a couple of reasons. The biggest reason the J&J vaccine has been less of a solution for a lot of people is just hasn't been available. I mean, if you go back to sort of when this was all beginning, I think the assumption we all had was that there would be a significant amount of J&J vaccine available reasonably early in the process, and that it would sit, you know, as part of the mix along with Pfizer and Moderna. And what's basically played out is there just hasn't been that much. I mean, have we had 250,000 doses of J&J in Massachusetts?
No, we administered 210,000. We might have about 230,000 doses that we administered.
So think about that, 230,000 doses of J&J since the end of December, and we have 6.2 million shots that have been administered. I mean, it just hasn't been as big a part of the answer as Pfizer and Moderna, because there hasn't been that much of it around.
Governor, looking ahead to the future, the Lieutenant Governor spoke briefly about the potential for children ages 12 to 15 to be able to get the vaccine in the coming weeks, that could see approval. Do you expect mobile clinics at schools for that sort of thing? How are you anticipating getting those out to students at that age?
I think we'll probably pursue the same process that we've pursued with the rest of this, which is we'll talk to a bunch of the experts, and based on the guidance and advice we get from them, make sure we have infrastructure in place that's going to work for that population. I think our goal at this point is to make sure that we have access to everybody who wants to get a vaccine. And in particular, our primary focus at this point is on a lot of those folks in disproportionately affected communities, and a lot of those folks who are part of the hesitancy community, for lack of a better word, and try and do more to make opportunities and options available for them. But with respect to the 12 to 16-year-olds, we'll spend some time talking to the experts and figure out what the best way to get them vaccinated will be.
Doing these mobile clinics to schools, is that something that you're considering, or is that something that...
Everything is always on the table, seriously. I mean, and if that's something that turns out to be an operative process, we'll certainly consider it. The thing to remember here is you're still talking 2 doses, Pfizer and Moderna. Still comes with all kinds of issues around storage and prep and all the rest, and we have a less than 1% lost vaccines at this point, and we're going to want to keep our percentage there.
Last question. We're seeing cities and towns and regional collaboratives do more and more walk-up-based deployments for vaccines. How large of a role do you see walk-up clinics playing in the state's efforts going forward now that mass vaccination sites are going to be taken out?
Do you want to take a crack at that? I think the answer is they'll definitely have a role to play.
Is it time to move away from appointments?
I'm sorry, what was the end of that?
Is it time to move away from the appointment-based model?
Yeah, definitely walk-in clinics have a role to take any barriers off. What we have to do is make sure you have enough staff at the front end in order to register you as you come in. And so that's some of the changes that we're making this week, and you'll hear more about that. Yeah.
Secretary Sutters, would you agree that we're through the easy ones, and now we're getting...
There's been nothing easy.
We've been clamoring for people, websites crashing, crazy. Now there's like a lot of spots, and there's people, you know, my own daughter's like, I don't know.
Well, you should talk to her.
I listen to government paper every day. So how do we get to these people? It's going to be a public relations campaign in addition to just driving things to get people. Right?
So I think we feel good about where we are at this moment. The fact that 70% of people over the age of 18 have gotten one dose, and we're well on track to the 4.1 million people by the end of this month, early June. I think this next iteration, the reason we keep evolving the vaccine program is in response to how do we continue to reach the 30% of the folks who've not gotten vaccinated. So the walk-ins, for example, changing hours, many more pop-ups, the mobile clinics in places, expanding primary care sites. So, you may not be comfortable going to a mass vac site, but if you got a call from your doctor, you might go get your shot. So what we're trying to do now is to just continue to evolve the vaccine administration program out to community, out to particular populations. And honestly, all of us have, I think, an obligation to really talk about the efficacy of these vaccines, the safety it means that we can return to our new normal. So I think all of us have a role to play, and you'll see some more around public awareness and the like.
Thanks, everyone.
Governor, any new thoughts on different kinds of mandates? We talked about state employees last week. If the effort is to get as many people vaccinated as possible, you have it in your power to force a certain number of the population to do so. Why not?
I think we think this should be driven by incentive-based approaches. Make it easier to get vaccinated, easier to get an appointment, easier to find a location that works for you. The focus here really ought to be on creating positive incentives to get people get vaccinated. The idea that I would kick somebody out of a job, and especially in a kind of economy we have now, because, quote unquote, they wouldn't get vaccinated right away on an EUA-approved vaccine. No, I'm not going to play that game. I think what we ought to be doing is making it easier for people and creating positive opportunities for people to get vaccinated, and make clear to people that this is safe, it is effective with advisors and trusted voices. I mean, the clinics that are running in a lot of these community-based settings are doing very well. And they're doing very well because many of them are being operated either in or by or with folks who are really trusted voices in those communities. And we've talked before about the fact that there are a bunch of people who are hesitant about this who have very good reasons for being hesitant about this. And the idea that we would take those folks and basically make them choose between their rent and their food on the table and all the rest, when they have, in some cases, very legitimate reasons to be nervous about a government-run program that's going to put a shot in their arm. No, I'm not going there. I'm not going there. Thanks, everybody.
What about students, though? If it's open to 12 to 16-year-olds, would it be required to go back to school if it's available?
Could be. I mean, but that's not something we've talked to. And remember here, I think there are clinical trials going on for less than 12, aren't there? Yeah. So this could end up becoming part of the conversation around kids generally as we head toward the fall.
Thank you.
But it won't be as serious as what we've been dealing with under any circumstance, right? Just from a public health point of view. Correct.